faces and new faces. I'm Tiger Ross. I'm the consultant that's been working with the UHA IPA to set up the electronic healthcare record system. And that system is with Core Solutions, which is the company, and the platform that we're going to be looking at today is 360. So I'd like to introduce Jessica and Sarah, who are the main contacts for our project together. And today's really about, as you've read in probably my many emails, today's about learning how to use the electronic healthcare system so that you can go back to your agency and train your staff. That was always part of the contract. I know that there were a lot of people who wanted to send more people today. So to make that a little bit easier, we're going to do two things. One, we've figured out how to record this session, including the screen, so that if there's somebody here today that really needs to see this, or you have, one or two other people, I know a couple of different extenuating circumstances that couldn't be here, can watch the video on their own. The second thing is that prior to I'm leaving the position on November 30th. Prior to me leaving, I'll do a couple of just demo videos so that I do have them on hand of how to do sort of the basic services, since I know that today is going to be absorbing a lot of information in a very, very short amount of time. For our agenda in the morning, we'll be going over configuration, so kind of high level, how the system works, how you set up new users. I will totally turn the training over to Jessica and Sarah. They do this as a living. This is their skill. So they'll be walking through all of that this morning. We will have a lunch break from 1 to 2. It is on your own. Just make sure that you're back here at 2 o'clock sharp so that we can go over everything else. And then the second part of the training, you'll be given a username, and we'll go over some of the actual services. I provided some case scenarios based on my discussions with Donald and Brent, how to do an intake, how to do syringe exchange, how to, have a newly enrolled person and then add a safer second kit, or we'll go through sort of all of those pieces so that, again, many of you have different contracts in your agencies, but the shared contract, which is the STEP contract, the state contract, we'll go over those basic services to start. And I think that's it. I'm going to be in the back. If there's any questions that you have for me, let me know. There is a webinar tomorrow. We just learned about it. There's a webinar tomorrow morning. I will send out the information to everybody in this room via email and your EHR program contacts. It basically goes over the HCBS module that CORE has created and has had approved by the City Department of Health. So those of you who are doing HCBS services, once the system is finalized and we copy it in each of your own systems for your agency, the HCBS module can be added. It's very, very short notice because it's tomorrow, so they also have agreed to record that session so that you guys can view it at a later time. It may be helpful to check it out tomorrow since you'll have this in your mind, but all of these resources, today's training and tomorrow's webinar and some other things that I'll create will be available to use after today. So if you walk out of here feeling like, oh my gosh, I remember 2 things from that system, I have no idea how I'm going to train my staff, don't worry. We'll have this recorded and a couple of those other supplemental training materials. Any questions to start? Okay, I will turn it over to you guys.
Okay, so hi everyone, I'm Jessica. I'm a senior implementation consultant at CORE. I've been at the company for about 3 years. Prior to that, I actually come from a public health and global health background, so I was actually out in the community doing work. I've been working on this project for a little over a year now, so I've been working with Donald and Brent, and I was working with Jamie. I'm going to let Sarah introduce herself, and then really quick, just go around the room, introduce who you are and where you're from, just because we're going to be with each other all day, and then we'll get started. So there's a lot we're going to cover today, so we're going to go quickly, but feel free to ask questions. It doesn't bother me if you ask questions. So go ahead.
Hi, everybody. I'm Sarah Angelucci. I'm an implementation consultant. I recently started working on this project with Jessica, so I'm just consulting with her really closely, getting to know the system. My background is EMR, so electronic medical records, so looking forward to working with all of you.
Dorothy Harris, I'm ASB, my student, a data manager, assistant data manager. My name is Donna Peschmaker. I'm from Bloom Health, and I'm the director of program operations. I'm Evelyn Milan from Buffalo, New York.
Donald Grove, I'm the system administrator for UHA in this project. Dan Asher, at CNS Corner Farm Production.
Rachel.
Brent, I don't know if, I think Brent, you.
Brent Gibson, I'm Director of Evaluation at NIRE, and I've been working on forms design and other aspects of the
Ingrid Stoyan, Ocean Center Corner Project on data study.
Joel Ozario from HACDAO, the data manager.
Michelle Bennett, I'm from Kansas Services Network of New York. I'm the HCBS coordinator.
Lance Morgan, Family Services Network, HCBS Program Coordinator.
Hi, Eric, Surrey Region Program Coordinator, State Conference.
Mitch Eisenberg, ACQC CFO. Jonathan Morello from Healthcare Manager.
Great. Well, thank you all for coming. Like I said, we're going to cover a lot, so I'm going to hit all of the really big points. I'm going to give you a tour of the system. I want at the end of the day you to be comfortable with the system, have a good idea about how you go in, set up additional services, programs, and how clients kind of can be treated through the system. We're really quickly also going to look at the aspects because I know, with HCBS, maybe down the road, you may want to be doing billing and stuff. We're not going to spend a lot of time on that, but I'm going to show you where it is and that it's in there because, so this is the out-of-the-box system that the IDUHA contract purchased, okay? And Donald and Brent and Jamie and everyone have been working to get some forms in here, set up services, programs, the ones that were shared with everybody, like all of your similar programs. Right now, the HCBS is not in here. That's a separate module, and they'll be demoing that tomorrow. So some people wanted HCBS, and you guys were all talking about that. So if you're deciding to go with that module, that can be added to this system. So it will be in here in addition, okay? You also have the ability within each of these. So this is like our master database right now, okay? Eventually it's going to get copied. You'll get your own, you'll have your own login, etc. For your agency. And then you'll be able to go in and customize it for your agency. So if you have additional programs, services, grants, anything like that, if you need additional forms, you'll be able to add those on your own, okay? So right now, think of this as like our backbone, the base, and then from that, you can build out what you need, all right? Okay, so the system is SaaS environment, so it's hosted, right? You're gonna have a URL to log in. Right now, the URL is ehr.cx360.net. When you're getting your own database, that might change. We might be able to put like boom.cx360.net or something, okay? But right now, this is where it's hosted. You come in, everyone's gonna have the same login. Company code, right now it's IDUHA. That will be different once your own separate databases are deployed. It'll be a code that's, similar, an acronym for your agency. Username has to be in an email. Okay, so the username's an email. We'll go through setting up users, but just kind of getting you familiar with the system. And then a password, basic kind of stuff. So when you log in, you end up here, and this is the home page. It's just like your landing page. It has a little bit of information, some kind of cheat sheets if you scroll down, just to remind you how to navigate through the system, nothing too in-depth. Really quickly, when we're looking at the system, we have these tabs at the top, okay? Each of these tabs basically directs you to a different function, a different area of the system. Everything we see today, I have user admin access. I have access to everything. Everything's going to show up. We're going to talk a little bit about securities and permissions, but what someone sees and what they can access is controllable to the user level, okay? So obviously people who don't need finance aren't going to have the finance tab. People who are not administering the back end aren't going to be showing configuration, et cetera, okay? So just kind of keep in mind, you'll be able to control down to the individual what forms, what everything they see, okay? And then the functions they're able to perform in the system. So we're going to do a really quick overview, and then we're going to focus a little bit on configuration. At CORE, we call configuration, it's kind of like customizing it, building it so that it meets your adding programs and stuff. So really quickly walking through, we have this one tab called Dashboard. This is really intended to be like the first place you go when you sign in for the day, okay? So it's going to show you appointments if you have appointments scheduled. It shows a list of clients that are assigned to you. Each of these boxes are called widgets, all right? Widgets all have different functionality, and they can be turned on per user. So there are some widgets that deal with clients. There are some that are more administrative, some that are financial. So users are actually able to control what they see. And it's meant to really give you just data at a glance in the system, right? Because there's a lot of data in the system. The system's all about data. But what's good is data if you can't easily see it and understand what's happening. So that's what's meant to be here, okay? Just kind of at a glance, what do you have to do during the day? My tasks would be have any tasks assigned to you. So in the system, we'll talk about this a little later, but supervisors can assign tasks to their staff. Staff can assign tasks to each other. Tasks can be automated. So every time a new client is admitted, X has to be done, that kind of thing. We call them alerts, and they show up in my tasks, okay? My pending tasks, as supervisors, if you're assigning tasks to your staff, they show up in your pending tasks, and you're actually able to track what's happening with that task. So you can see the client that it's for, and from here we could actually navigate to that client's chart. The task name, these can be your own. You have the ability to control what shows up here, okay? So whatever task to do someone has, able to track if they have been working on it, it's completed. Also change color if we're going past due and stuff like that, okay? So you're able to kind of see if people are completing the tasks and how of that. Here on this little thing is a list of all of the widgets that can be turned on, okay? So you see there's a bunch. We're not going to go into all of them, but some of them have a map. Some of them, you know, overdue discharges. There's ones for when you're people doing HCBS. There's financial ones. So what encounters are services in the system, billable services. So are you having any errors with that? Are you ready to bill? Like, how is your financial? So there really are widgets that can with every role in the system. All right. So the next tab is clients. Okay, clients is how you access a client chart. In the system, because it is a medical record, we call everybody clients, but this is really where all that individual information lives, okay, where you're going to be filling out forms, doing intake, filling out profiles, etc., is in the client chart. The search bar, you can type in first, last name, a part of the name, and it will search and find any client that is similar to what you've typed in that has a piece of it. You could also search by date of birth and social, which is not as relevant, but from there, it'll populate a list of clients. When you click into your client, this is where their chart opens, okay? So this is where all information that pertains to this one client lives in the system, all right? So in here, you know, we have forms, and Donald and Brent have built some IDO specific forms, any HCBS specific forms that pertain to an individual client live in the client chart, okay? We're going to talk about ones that don't necessarily live in the client chart. And, you know, I know we do have this three-tiered structure. Not everyone is a completely identified client and have this chart, but this is where those clients who have an open intake, you know, they've been given that number, you have basic information, all of that lives here, okay? Right now, I know there's still like the three-tiered RFC that hasn't been done, so this will be slightly different once that kind of gets decided. So I'm just going to show you how it is right now, and then you can decide proceeding in the future with the anonymous kind of aspect and all of that. So really quickly, up at the top of this chart, you're able to upload a photo of a client if you want. It's going to show you some basic information at a glance. If there are any to-dos, alerts for this client, okay, they can show up here. So if you saw we had one that was client banned, it can show right here kind of in the header to see those kind of basic information. When you're going through the client chart, we have these different folders, which we call accordions, okay, because they expand and contract. And within each accordion are different forms, all right? So when you can open different forms, navigate this way. These can all be renamed and forms can be moved around, okay? So this is just how they were deployed. But for your specific agency, it is able to rename them so that they're grouped together in a way that's relevant for you, and you can choose what forms go in them. So this is just the out-of-the-box layout for now. And you're able to open up various forms. And when you open a form, it will come to this, and we call it a grid view. Okay, this is something that's going to be the same throughout the entire system. So when you open up a form, utility, etc., this is going to display all of the saved records. So if there were more displayed records for this one, they would continue to populate down the grid view. So if you're filling out a form for a client or something, and you're doing it multiple times over the course of months or years, you're going to have all of those records right there, okay? The goal in the system is information's never deleted, we never remove it, we're just adding because we're keeping that history there. So it's going to save and it's going to show you that history as you go. And from this grid view, you can always go in and open the individual record, or you could enter a new one, all right? So we're going to spend the afternoon on this kind of client chart intake process, but I'm just kind of giving you the lay of the land so far, all right? So the next tab in the system is the scheduler. This is a calendar, kind of like Outlook. It has basic calendar functionality. You're able to show the calendar for the individual or for the entire staff. So if your organization, if you decide to use the scheduler, you can pull up and see all of your staff's appointments. You can filter by an individual. You could filter by specific locations. And we're going to talk a little bit about what locations mean in the system. Or a staff type. So if you group your staffs into types, administrators, clinicians, however you're identifying and grouping people, you can also pull up that group's calendar. So it will filter through that. There's some additional functionality for more like centralized scheduling. And we can talk a little bit about this again this afternoon, but you are able to enter things like user availability and stuff. And based on that, search and find appointments, figure out who's available. So there's a lot of functionality in here, and it's kind of how much do you want to use it. You're not forced to use the scheduler, but it is a tool that's here, and you are able to use it. All right, so the next tab is the finance tab. This is where for any billing or payments or anything, either now or in the future, and with HCV, I'm sure they're going to go over this on the demo tomorrow, but this is where a lot of that's going to be done. You'll be able to generate bills from here. There's a ledger where you're able to actually see individual clients, their services, any charges, payments that were received, and all of that, okay? We'll touch on it a little this afternoon. I know we're not doing a lot of traditional billing necessarily right now, but in the future and with HCVF, you are going to have all of this functionality in the system, so it comes with it. And we'll touch on it so you're familiar with it. Okay. The next in the system is reports. Every field in CX360 is reportable. Any form, any utility, anywhere you're entering data in the system, we can pull it out. Right now the system comes with, I think it's like 40 or 50 pre-built reports. Okay, these are just what we think people use frequently. There's also a report designer where you're then able to go in and build your own reports, ones that are valuable to you. So if you look at these and they're not relevant to you, there's a tool and you're able to go in and build your reports. As you build out your own forms, we can also make those fields reportable. So when you have your own system and you're for your agency, maybe you have an additional admissions questions you ask or something, and you need to add that into the system, we are able to turn that on and make that reportable as well. So basically anything you're entering in the system, there is a way to report on it. As you scroll through here though, we do have these different report categories, and again, we've just grouped them by basic functions, but so you can run client lists, lists of tasks, etc. There's ones that deal with finance and all of that. When you open a report, it does pull some, basic filter information. So you can filter by things like name, birth date. I'm in the client's report. So you really are able to drill down and get information you need. You could add additional filters. So I could say I want all clients who are male that were born after 1995. So you can keep adding filters, to be able to pull out the information that you need. And then the reports can be downloaded into Excel. So you're able to pull the reports here, but then you download into Excel and filter that way. Some people are more comfortable with working with Excel. So, you know, there is a lot of functionality with all of the reports in the system. So one of the tabs that you guys are actually going to be using a lot, Utilities tab. All right, so when we were in the client chart, how I was saying forms in the client chart pertain to one individual. Okay, so if I was filling out a questionnaire on Sarah, and it didn't involve anybody else, that form would live in the client chart. If I was filling out a questionnaire on this group as a whole, that's multiple clients, that would live in Utilities, okay? Client chart are forms specific to one person. Utilities could be specific to a group. They could deal with people who are not even clients at all. It could be staff interactions. So this is where you're registering information for people who don't necessarily have client charts, or when you're registering it for multiple people at a time, okay? So just want to make the distinction between client chart and Utilities. And a lot of what has been built, especially around like AIRS, a lot of that does live out here in Utilities as well, okay? So we do have the export in here and some other utilities Donald has designed, you know, relating to that AIRS piece. And then eShare, they will also most likely be living out here in Utilities, some of it. All right, so finally, this little gear looking thing. This is where configuration is in the system. So in the system, you know, it's deployed, it's out of the box. All of this functionality is here. Deploy a bunch of forms that we give to everybody. You know, they're basic kind of forms, intake, basic demographics, diagnosis, you know, all that like standard EHR medical records stuff. Configuration is where you set it up so it works for your agency, basically. So we deploy a backbone of the system, and you're able to then go in and enter your programs or your services. This is where you're setting up your users, where you're building your additional forms, or where you build your custom reports. So really think of this as like where you're doing all of the building and customizing, setting it up, okay? That's all done here on the configuration menu. You know, you're only gonna be having your admins, anyone who's like administering the system, your data people. You're not gonna be giving a lot of people access to this because people can go in and change stuff and create. But this is where really all of the behind the scenes stuff is happening in the system. It's here on the configuration tab, okay? So we're gonna talk about this now. It's get detailed. I'm gonna try not to completely fry your brains. Ask questions if you want. And we're gonna kind of spend the rest of the day here in configuration talking about the setup of the system. And then in the afternoon, that's when we're gonna go into the clients. We're gonna see the intake process. We're gonna look at the AIRS export in more detail and all of that, okay? Okay. So as I was saying at the beginning, right now this is kind of this master database, all right? This is the one that was built for all of the IDUHA agencies to have like the basics in there that you share. I know there was a spreadsheet where there was some shared programs and services. They have been populated in there. You're able as an agency to use them or turn them off, but they're what's going to get deployed when the system's copied. So you don't have to go in and do that, all right? So it's already in there. You're then able to go in and add the stuff that's specific to you, all right? So we're going to go through and look at the setup. This is going to be the same in your system, okay? And then you'll be able to add. So it's not going to look any different than this. It's just you're going to be able to go in and kind of play and do what you need, all right? Excuse me. All right, I want to point out two pieces really quick. So the backbone of the system, so the ultimate goal of an EHR, right, is to be able to track the client and bill. And the way this is set up is for creating the hierarchy that will ultimately let that happen, okay? This is going to be the same with HCBS. I know they've pre-populated a lot of this, so you won't have to go in and like enter any of the HCBS stuff. I just want to explain the structure of the system because you're going to kind of see it throughout the rest of the system, okay? Even if we're not billing, it's okay. It's not for that, but that's why we're going to have these two, like this hierarchy that's there. I just want to explain why it's there so it makes sense why you have to do, okay? So the first piece is this define organization. This is where you're going to say who you are. So if you're Boom, that's the company, okay? You're then going to say what Boom's programs are, what their services are, all right? This is where you say who is giving us money. Is it heirs, eShare, HCBS? Payer doesn't have to be an insurance company. It doesn't even have to be somebody that is giving you cash, okay? This is just like, where are you registering these services against? Like, was this an eShare service or something like that, okay? It could be any grant, any payer, eventually any insurance company. It could be out of pocket. That's all payer, okay? Contracts and reimbursements, that's where we're going to actually link our services to our payers, all right? This is going to make a little more sense as we get through it, but I just want to explain the two basic boxes, structures of the system, okay? So we have our organization section, and then we have our payer section. And we kind of have to go through, as you're building out any additional programs or services in your system, you have to start over here in this top left box, and then you move to this right box. So there's actually like an order, and you'll see as we go why, but it's actually building off each other, okay? So really quickly, we'll go to company. There's only one record for company. You can only have one company in the system. That's going to be your organization, okay? Right now it's set up for I do have, but obviously, you know, when this is deployed for your own individual ones, you'll be entering your basic company information here. All right. Company name, street address, phone number. You do have the ability to attach a logo. If you attach your logo, it'll come and it'll pull into reports, all of that kind of stuff, patient statements. So that logo will follow through the system, and you will be able to print things with your logo on it. Key identifiers. So everything on this company page, you know, would a bill. So that's why there are placeholders here for that billing information. If it's not relevant, if you don't have any of these numbers, that's fine. They don't have to be entered. So fields in the system with an asterisk are required. Fields without an asterisk are there if you need it, okay? Everybody's different all throughout, you know, behavioral health, medical, et cetera. So we have placeholders for things that clients may need, but don't think that just because it's there, you have to have something in that field, okay? Treatment and content. There is a treatment plan builder in the system, okay? U means it's driven by user-defined options. We do also have some clients who purchase a treatment plan library through Wiley. So this is why we have this option here. You would change it to W if you purchase Wiley, but you would just put U, okay? And that means, like, if you build your own treatment plan, you're defining what's in there. You didn't purchase a library. Everyone asks about that, so I'm just always going to, like, reiterate what everyone always ends up getting tripped up about, okay? So treatment plan content, U. Once you have your company, you can then enter locations. In the system, there are 3 types of locations, all right? Service locations, billing locations, and pay-to locations. So what's the difference? A service location, think of it as like any distinct place where you're providing services. You may only have one location. So maybe this building is our location. This is the only place we provide services. We don't need to break it out or define it in any other way. We want to say we provided our services at this building, okay? Maybe we provide different services on different floors of this building. So we could set up 3rd floor, 2nd floor, and they could be set up as distinct locations in the system. You don't have to break it out. We have the ability to break it out. So why would you want to do that? You're able to assign clients to a location, okay? So if you have people, maybe you have, most of your clients are seen on the 2nd floor, okay? But your ones who are going to become billable clients are seen on the 3rd floor. And maybe because we're tracking, you know, Social Security and more identifying information, you have different security procedures for that 3rd floor, the 3rd floor clients. You can break them up that way. And that way you're also able to, like, what staff can view things. We're going to talk about this in securities a bit. But being able to, creating multiple locations, it helps you secure. So it helps you kind of break apart populations. It makes it maybe easier for reporting. You don't have to do it, right? But if there is a reason to track different service locations, you are able to set them up in the system. Does that make sense? Locations either make a lot of sense to people or they make no sense. So it's okay if it's confusing. Okay. Let's just look at one really quick. So company name, as I was talking about, there's a hierarchy in the system, right? So as we keep working through, we're going to have to select things to associate. Yes, there's only one company. You still have to pick it because it's making that connection, okay? So you're just going to pick your company name. Location name, this is, what do you call it? This is what you're going to see. So when people select it in the system, when they view it, that's the name they're going to see. Don't name it something no one's going to understand. You know, what is that location called? Pretty obvious. Code. Sometimes for reporting or billing, agencies need a particular code assigned to, say, a location, all right? That's where you would enter it. And that's why it's here, because we do have people who need this for reporting. If you don't, come up with your own naming convention for codes, all right? It doesn't matter unless you're reporting on it. So if you don't have to report a specific code, so for this building, we don't have to report X43, then come up with your own naming convention for code. You see this code field a lot in configuration, and it's going to be the same, okay? It's there if you need to be able to, like, report with that code. If not, it's your own code, your own internal code, whatever you need it to be, all right? Address. So we hadn't talked about it.
I'm sorry, you said we can interrupt. I don't really understand what you mean.
Okay, so I'm not sure it's relevant for you guys. I don't know if you guys have codes that you have to report from this field. The AIRS codes are in reimbursements. But say you had a grant, and when you submitted your bill to the grant, they didn't want to see Harm Reduction Center. They wanted to see X12. Okay, that's where the code would be. If that's not a scenario for you, you still have to enter a code, but you can, it's alphanumeric. It can be any combination you want. So if you don't need that, ignore it. Come up with your own. Does that help? Okay. Zip codes in the system, this is going to be the same throughout the system. This is actually a field we call a lookup, all right? So it has this select box, and when you open the box, it will populate with a grid, all right, where you can search for information. So in the system, there are all of these zip codes. You could go in, you could enter a zip code in the lookup. You can search by county. You're also able to filter all of these. So this is, again, something that you're going to see all throughout the system. So these lookups have this like advanced search ability. So you're able to filter columns, search for a particular word. You're going to see these lookups whenever there's a lot of information. All right. So on a drop-down, you wouldn't want to see 200 options because that's not very manageable. So that's why we put that in these lookups. You're going to see this with client names, et cetera, where you might have to search through a whole lot and you need the ability to kind of do that advanced filtering and searching. Okay. When you pick a zip code, it will automatically populate with the city and state for you. I'm not going to change this, I won't save it. So you have the ability, again, to enter a phone number, fax number, TIN, so just different identifiers. So if you're billing from this location, it's a billing location, you can designate that you have a provider signature on file, which some payers need, but that's what that box is for. Billing location and pay to. So we talked about service location, this building. We see all of our people in this building. This is where we provide services. Maybe this is where we see people, but we really bill, like our billing address, the address we send out is that building. That would be our billing location, all right? And we would make that link here. So we would say, we provide services here, but if you send out a bill, whatever report, you really need to put that place's location, that address, okay? So that's where we link our billing and our service locations.
I just wanted to ask for the location, but I know it's not much on the HCPS program, but sometimes the services are conducted in the client's home.
Mm-hmm.
Will we put their address as a location if that's services are taking place at?
No, I will show you where that is. So this isn't the place of service, like that place of service that goes out. I'll show you where that is set up. Yeah, so don't think of this as place of service. This doesn't have to be like office, client, home, city, any of that, those HIPAA codes. Yeah, this is just like your location. So, and if you're tracking, so something people will frequently do though, so you may set up a location called community, okay? So if you wanted to track how many services you performed out in the community, you could call your location community and then set your main office as your billing location. So that's that flexibility where if you need to be tracking or reporting other places where you're doing things, you can do it. So I will also caution though, I did have someone who thought they went out in the community and they maybe provided services at 87 different community centers. And they went in and tried to enter all 87. Recommend doing that unless you absolutely have to do that because that can become unmanageable. Okay, so try to figure out ways to group it, you know, kind of thing. So I wouldn't go in and enter all 100 places you may go to kind of thing, but you could set up community, you could do districts. So if you have like zone A, zone B, that kind of thing, you can also set those up as locations, okay? So our billing location is saying put that name, put that address on the bill. Our pay to location, so maybe our bill has to say that building, but we should send the check to the building over there. That would be your pay to location, okay? They could all be the same. You don't have to have separate billing locations, separate pay to locations. If it all comes out of this building, okay, you just have the one. But you do have the ability to add, all right? Especially if you have those different services, because if you set up community as a service and you were to bill for that, they might be like, what? We don't have that in our system. You know, we really need your organization's name. So you would have to set up the billing location. Okay. There's this account information. We do actually have some clients who are payers. So this isn't really relevant to you, but that's why it's there, okay? So they actually, instead of being providers, function as payers, and they're able to get that set up. So there are fields in the system that may not be relevant, and I'll tell you what you don't really have to worry about. So don't worry about this banking account information, okay? Any other questions on location? Yeah.
Could you just show location additional things so people
Yeah.
can see what we've got in terms of, there's an AIRS location ID and an eShare location ID. Put those in so that when you export the records to the system, the site just calls what it needs to be called in AIRS. What it needs to be called.
Yeah, thank you. And really quickly, because I know when you all have access, you will go clicking around and wonder what some of this stuff does. Location file, you're able to like specify additional information about a location if you need to. So is it open 24 hours? Do you only accept men? Do you only accept women? This isn't mandatory. You don't need to fill this out, but with scheduling or admitting, this can like tie into that. Okay, so if you're trying to schedule and you need to find a facility that accepts men and it's open after hours or something, you can set that up here. But again, you don't need to enter this data, but if you do, it does kind of talk to other places in the system. But this is where you can define more information about a particular location. All right, so the next two items, I'm going to kind of talk about programs and services. In CX360, a program is a grouping of services, okay? So clients are enrolled in programs, staff is assigned to programs. You know how we were talking about locations and how that could help with security? So if staff on the third floor who are seeing those HCBS billable clients are the only ones who can see the records, you can select securities by that. Same with programs. So you could say staff can only see clients that are in the same program as them as a way to lock down HCBS or something like that. Okay. So like how we have to think with our location, Is there a security reason? Is there a reporting reason to break things out? The same for programs, okay? So we assign clients to programs. We assign staff to programs. We then have the option of restricting staff so they can only see clients in their program, in their location, okay? I'm going to talk about that again, but I'm just going to keep reiterating like why some of this matters. Some have already been set up, okay? So the ones that were already set up for IDUHA will be in your system, but this is where you're going to start to enter additional information for your agency if you need to, okay? So if you have unique programs, ones that aren't in here, you'll be coming in. So programs are groupings of services. When someone is enrolled in a program, they are then allowed to use those services, okay? So if you have one program, say, and you put all of your people in one program, you will see a list of all services. You'll be telling the system this person is eligible for all services, okay? So that's like the implication. If you have 10 programs, you could assign that person to 1, to 4, to 5, and that again would be telling the system what services they're allowed to receive. Does that make sense? Okay. Yeah.
So this means that you can do it like an inter-office referral sort of thing, like
Yeah.
from a women's group to the C group or something like that.
Yeah, exactly. You could set both of those up as separate programs if you wanted, and then you'll be able to refer. You can enroll and discharge from individual programs while leaving that client open. So if you had 5 programs, as the client kind of moves through your organization, they could become enrolled in programs, discharged, et cetera, and you can see that history. But yeah, that's exactly what it is. Okay, so very basic, our program. You name your program. You have a code. Again, remember how we were talking about codes. If you have to have a particular code here, you put it. If not, come up with something. HRCC, you know, an acronym for the program, just to have a placeholder. PAC code, you don't have to worry about that. That's Pennsylvania specific. So really, you're just entering program, and then you're assigning your program a code. Really basic form. The reason that's so basic, because it's just a way to group our services, okay? So the service is where you're actually going to be entering more of that relevant information for that service. Okay, so services, this is what you do, what you provide to the client, okay? For billable services, it might be a CPT code. I know some have already been entered in here, the ones that were like kind of standardized across all the organizations. The HCBS will come with the HCBS services, but this would be, so say we had women's group, and in women's group, we offered 30-minute group session, 15-minute individual counseling, 60-minute assessment. Those would be our services. So in our group, what do we do? What services do we provide? We set those up here on the service screen, okay? So you're entering some basic information. Again, you're linking it to the program because programs are grouping of services. So we would have women's group. We would then have our service name. This is what your staff is going to see, okay? So it has to be something that means something to them. This is what they're going to pick when they're saying they provide a service, okay? Service code, again, that code field, you know, your code. Bill type is an inpatient, outpatient service. In the system, because it is designed as an EHR, everything is set up with the structure of billing. That doesn't mean we're billing, that doesn't mean we're creating a charge, but that's why all these fields are here, and you would still need to select some of them, okay? So you can have a service that's 0 and we never create a claim for it, okay? That doesn't matter. These are non-billable services, billable. We're setting them all up the same way, okay? Yeah?
Sorry, I'm not understanding the difference between the program and the review services. That's perfect.
Okay, so let's say your organization has 200 services, okay, just to keep a nice round number. You could set up one program and say, this is what we do. And then everyone is available to receive all 200 services. And if that's how you operate, you can have a program and just put all of your services in there. But maybe you have a women's group and a men's group, and in reality, men aren't going to receive women's services, women aren't going to receive men. You can break them out, and it actually, so if I had one program, 200 services, and my staff went to say they did something for a client, they would have a list of 200 services to pick from. If we broke it out into two, we would cut that list in half. So it's kind of making services more manageable in the system. And then that's one aspect to it, okay? So to help reduce error, because you would never provide a women's service to a man maybe or something like that. The other is for security purposes. So if you did have clients that were billable and you had only the staff of a certain level who are HIPAA certified or whatever could see those client charts, having that as a separate program means you can block your other staff. So it's like a two-part. Part of it is like user mobility, pick lists and stuff like that. But the other is that security aspect. So do you need to lock down certain programs and that kind of thing? Do you want, if you had 3 locations, do you want staff to be able to just see everybody? Do you only want them to be their own people? That kind of thing. Does that help? Okay. Did you have a question?
Well, I was going to ask, building on that, like if you break them into separate, let's say you make women's and men's services, would you then be able to click on one and have individual drop downs for each, like for those?
Yeah, so if you, so say, okay, so say we had a client, right? We had client John Doe came in, and we had our women's and men's services, like program. If I assign John Doe to just the men's program, when I go to that list to say what I did, I wouldn't even see the women's services, okay? If he was enrolled in both, okay, when I had my list, I could filter by program to help limit the search as well. So it's giving you that ability to filter, just make it a little more manageable. You don't want to get so granular with your programs that it's a nightmare enrolling clients in it, trying to get them the services they need. Okay, so I don't recommend coming up with 30 programs just for the sake of having 30 programs. But if you need to divide them out, you know, restrict information, limit what staff see, help them with pick lists, you are able to break them out too. Okay. So this is kind of, I spent a lot of time talking about this because for some organizations, it's really obvious what your programs are or your services. For some, it's a little harder. Same with locations, okay? So it's kind of thinking, how much access do you want all your staff to have? How much enrolling, unenrolling do you want? Do you want to be able to track like levels of care throughout your organization? You know, it's that kind of question to ask yourself.
And I think for I do have purposes, I think one way to think about programs is to associate programs with contracts.
Mm-hmm.
That's a really easy way to think about how you would probably want to break it up. So your SEP contract, you're gonna have as a program. And then all the services under that would show up for your folks who do your SEP. If none of your SEP folks are also doing case management, then your case management stuff could be somewhere else. If you've got a Ryan White contract, for example, then everything you do for the Ryan White would show up under a different program. Those services would SEP and Ryan White staff would only see folks who are enrolled in their respective programs.
Thank you. Does that help? Okay. I'm glad you guys are here to help. Okay, so we have our service, right? What is our service here? Our hepatitis care coordination. For every service you have in the system, you have to set up a. This is just for the system not to get confused, so the system thinks it's valid. Okay. Couple things about service rate. It can be 0. If you don't set it up, stuff is still going to work, but it's going to like move to the error log because again, our system wants to bill, like its purpose in life is to try to build something. So it wants to bill, okay? So if you don't set it up, it's going to get like confused and be like, why aren't you trying to bill? And it'll just kind of jumble up your error log, and I'll show you your error log. But so for every service, even if it's not, we set up a service rate. Staff type. There are 3 different staff types in the system. We're going to talk about the other 2 later. This is what we call a billing staff type. It could just be 1 for all of your staff. You could set up 1 staff type. In user profiles, when you set up a user in the system, you assign them a billing staff type. You know, in a traditional medical thing, it might be like doctor, you know, therapist, that kind of thing. And it correlates here. The reason it matters is it correlates to the rate, okay? So because, again, going to like a hospital, you might get paid more for a doctor than you would a nurse, all right? You can have 1 staff type rate, okay? But you do have to, I want you to understand why there's this staff type here and what it ties to. The reason it matters is if we have 2 staff types, okay? So maybe we have staff type A, staff type B, people have A, half have B. We only enter a service rate for staff type A. Again, our system's going to get all confused because it wanted to generate a bill and you told it only staff type A can do that service. Okay, so this is telling the system who can do that service, basically. Does that make sense? So even if we, it's going to get a little cranky if we don't tell it both A and B can do it, is essentially what's happening here. You know, for like your HCBS services and all of that, this is where you're going to put in your rates, what gets billed, etc. So we pick a staff type, our usual charge. Services, the service rate is your rate, your agency's rate, your total usual charge. How much does it cost you to do this? Maybe your total usual charge, you have determined it costs your organization $100 to do this. Reimbursement rates is how much are you actually going to get paid for it. So maybe this costs you $100 to do, just using HCBS example, but for HCBS, they've said we're going to pay you $60. You have the ability to track both, okay? So if you want to track as an organization, how much is it costing you to perform all these services because maybe you want to go for additional grant money or something in the future, you can track that stuff than what you're actually getting back, okay? So service rate, how much is it costing you? This has to be greater than or equal to what we set up as our reimbursement rate. You could also put this as 0. So if you don't know, you don't have a rate, that's fine. In the future, if you want to break that out and start figuring out your rates, you can. So we can set it at 0 too, okay? But we do have to put something in here. Effective from and to. Everything in the system at this point is like a validation because like I said, this wants to bill, okay? So if we set our effective from and to date, maybe I say this is my rate for 2016, so it's effective from January 1st to December 31st. If I come in January 1st, 2017, and I updated the system or added a new rate, the system's going to get confused. It's going to say, hey, you said this can't be done anymore, so it'll error. If your rates don't change, put it out like 50 years in the future, okay? So effective from, effective to, like 2050. All right, but if you annually update your rates or biannually update those rates, this is where you can set it up in the system. All right.
What type of alert does the user get if the effective to is expired?
We can demonstrate this later. It'll tell you no service rate found or no reimbursement rate found, okay, because it's like hinting at you where to go look. So if your staff type was wrong, if your effective from to was wrong, it'll say no service rate found, okay, because it couldn't find a valid service rate for that service for that person at that time. All right.
Will it do it at the time that you try to
When
enter the service?
you save the encounter,
Uh-huh.
so I'll set one up. We can actually error one out in our demo later. Okay. But yeah, that's what it's going to do. When your clinician goes, your person goes and saves an encounter, and encounters are where we enter services in the system. So when you tell the system, I performed this service for John Doe today, If this isn't set up or it's incorrect, you'll receive a pop-up error. But we'll look at that later. All right, and finally on here, duration. So it costs us $100 to do this service for 15 minutes or 30 minutes, okay? That's what duration is. Duration is in minutes. And is it a per diem? Which would say ignore the minutes. Okay, so you can still track the duration, but a per diem would be, doesn't matter how long we spend, we still only get paid $6 or something, okay? Any questions about that? We're doing good. We're halfway through our little two-step process. Okay, that's a lot of information, and I apologize. But I just really want you to understand, you know, as you're like going and playing with the system yourself and adding additional programs, you know, what you have to do and why you have to do it. Even though I know, you know, we're not doing a lot of that traditional billing right now, you're like, well, why do we have to set it up that way? And it's just because, like I said, the system wants to bill, right? So even if we're not billing, we kind of have to trick it and make it happy, okay? All right, next. Payer. Grant. HCBS, Aetna, Medicaid, those are all payers, all right? So heirs, eShare, that could all be payers. So who are you telling this information to? Who is paying you? Who's the grant? Any of that could be a payer. If you collect out of pocket from people, out of pocket patient pay is a payer, all right? So telling the system who's responsible for this is basically what's happening. It allows you to track, so heirs, right? It allows you to track how many heirs services were provided. So the system is linking all of this, okay? So it gives you the reporting ability, all of that. You assign payers to a client. So if you have a program for heirs and a payer for heirs, you'd enroll your client in heirs and then assign them heirs payer, okay? So that's what we're doing here in payer. Again, a lot of these have been set up for you, okay? The basic ones, you would only be adding your own grants, your own HCBS or any additional kind of things you need to track, okay? And the HCBS ones actually come preloaded in the module. So it would just be if you down the road or even now do have additional grants or you're getting Medicaid services or anything like that, all right? Really basic information, kind of like how program was like a placeholder and we like attach stuff to program, the same is happening here in payer. So we just name our payer. It says insurance company, but insurance equals payer in the system. Again, you have your own code, all right? If it has to be a code, you put it. If not, an internal code. These next fields are for electronic billing, sending out 837 files. So with the HCBS, it'll be set up, but you know, if you're sending an electronic file to the payer, they give you a number, they have a number, that's for all of this. They're not required, so you leave a blank if you don't have them. Medicare assignment, cookie. So Medicare assignment, again, you know, that's for billing, but it's basically saying you get paid, who do they send the money to? Do they send it to you? Is it assigned? Do they send it to a client? That kind of thing. So like traditional billing, it's usually A. So you just put something in there. But again, if you're not sending out a bill, it doesn't necessarily matter. You just have to have something in there. The output A is usually a way to go. Sometimes people will have C, but that means the insurance company sends the check to the client, and probably don't want that. So, all right, insurance, easy. All right, just name your grant, etc. Contract. The reason contract and payer are separate is because let's say there's heirs, right? Heirs is a payer, but maybe there are 12 heirs contracts, or they change every couple of years, all right? So with HCBS, maybe HCBS has a contract you negotiate for this year, the next year you have to renegotiate or something. That's why they're broken out, because you can track your contracts. Remember, the goal of an EHR is we don't need information, we like add information and end date. So if we had a contract for 2016 and then we had a new one in 2017, we wouldn't delete the 2016 contract. We would use like that end date, that effective 2, and then we would add a new one, all right? So we're just kind of continually adding. If you don't have an end date on your contract, put it out to 2050. okay? So you don't have to have a short end date. If there isn't an end date, put it out way in the future so you don't have to deal with it, okay? This is where we start to enter more information, all right? So payer, we link to our payer, okay? Company, again, it's going to be your company. We're making these like joins in the system, okay? Contract name, whatever the name of your contract is, make it something you're going to understand. If it is like an annual thing, you probably want to put a date in there or something. So when you're looking at a list of, I know this is not relevant for this one, but 20 SEP contracts, you know, and they're all dated, you want to know what it is. So make sure your naming conventions mean something to you at a glance. You know, think about using the system for 5 years. You're going to start to get a lot of data in there. So you come up with a standard kind of naming convention that's going to mean something to you, and you'll be able to see what you're looking at and understand it. Code, again, this is our internal code unless we have to put something in here. Addresses, so this would be, you know, the address on the contract. If you remember, we didn't enter an address in the payer, right? We did it in the, so this is where we're entering that address, the address on the contract. Valid from, valid to. So again, that system is looking for that date, all right? And it's going to error out. It'll come up with a reimbursement rate error if our contract end date. So that's why we put it way out in the future unless we do have a specific date range, okay? Over here, these billing fields, this is, you know, for like, if you're doing a bill, CMS 1537, we can talk more about it, but this would be like overriding what gets sent out in a bill. So sometimes the payer will say, we don't care who did the service, always send the Sally's name or something like that. This is where you would set that stuff up. A ton of times, I'm not, unless, is this relevant to anybody? I don't want to, but you're able to kind of set that up. These are always defined in the contracts. Your payers tell you what you would have to put in these fields. So after you enter the contract, these additional tabs appear at the top, okay? Definition by location isn't always used as much, all right? But you're able to, so maybe you have 3 locations, all right? And you have to report a certain number for all these 3 locations, except for this one contract, but they want a different number for this location. That's where you would put it. This is like limiting. You don't have to fill this out. This would just be if it's an exception. Okay. So if you had a different place of service NPI number or something for this one contract for a location, you put it in. It's rarely used, but again, just because these tabs are here and when I leave, you're going to wonder what they are. I'm just going to explain what they are, okay? Billing template. If you had, if you were actually going to generate a bill, okay, if you were going to send your bill to HCBS, a template will be attached. This is where you tell the system what type of bill to send, all right? So if you're not generating a bill out of the system, you don't have to attach a template, okay? But generating a bill, are you sending an electronic bill, an 837, or a paper bill, a CMS 1500? This is where it is attached, okay? Once you attach the bill, they're pre-built into the system, so they're pre-mapped and stuff. I'm not going to attach it because I'm in one of your actual services, but it'll show all of the mapping, the loops and segments, and you're able to go in and manipulate them and, you know, make sure it's meeting payer requirements. I know with HCBS, they'll be pre-set up, so it would just be any additional payers, either now or down the road, where you had to send them a billing file. You would go in and attach the templates here. All right, last one. Reimbursement. This is what links the 2 boxes together, okay? So this is where we tie our service to our payer, okay? So heirs, right? We had an heirs program, we have our heirs services, we have our heirs payer, all right? Heirs contract. We have to link the 2 so that the system knows when you provide that heirs service, you should tell heirs that you did it, okay? So who are we billing? Who are we telling? Who are we reporting to? This is where we're linking, okay? So for AIRS services, we would have to set up AIRS reimbursements. And they're already set up, okay, I'm explaining. So as you build out your other stuff or additional contracts in the future, you are going to have to link them, okay? So if down the road there were 20 more AIRS services, you would come in and you would set up reimbursements, kind of thing. All right, pick your contract, pick your service, because remember, we're linking a service to a contract. Got your own code. If this is like a billable service and there's a HCPCS code, you would enter it here. This is information that's going to flow out on your bill, okay? So the system's trying to come up with all this information based on the data you enter. So you don't have to, when you go to bill or report, you're not having to like enter codes by hand. You know, it's actually going to pull it all out for you. The ability to enter a minimum and a maximum duration of service. So if you have a service that in order for your grant to pay you, your payer to pay you or something, maybe it's a 30-minute service, but you actually have to spend 15 minutes with that person, you can set that up here. And again, this, when your clinicians, your staff enters a service, it'll error it out. So you're setting up validations here, okay? So you're telling the system what makes this okay. And the system will actually catch people and tell them you made a mistake, you need to enter this information or something, okay? So that's what you're doing here on this tab. Create claims for reimbursement. If it is billable, if you're reporting a number, a value, you're sending a bill, you would check this box. This tells the system, hey, actually figure out the charge based on all that information we entered, like how much are we coming to? If it's a non-billable service, don't check the box, okay? So this creates a charge, not checking it creates no charge. So you're able to still track non-billable services. It's like creating tally marks, right? So you can still see how many of these did we do, how many locations did we do, that kind of stuff. You're still tracking information, but you're not creating a charge yet. And then maybe someday in the future it'll become billable. You can actually just come and turn this on and you'll start creating charges. Okay? You're able to say if an authorization, so I'm not sure with HCBS, but if you're required to have prior authorization to be able to perform a service, if you select this box, the system will actually look to see if an authorization number is entered, and if not, it'll move to the error log so that you can't accidentally bill it if authorization, okay? So it's catching that for you. Units optional, this was more popular in the past, but that's just saying, so like when you enter an authorization, if you were authorized 20 visits, okay? Checking this box would say, no matter if you've exceeded your 20 visits, it's still okay, which typically isn't the case, right? But it's just saying all you need is that number. It doesn't matter if you're like out of visits or something. Required diagnosis, again, on the encounter form, you're able to attach this. This is going to be for more billable services, but if HCBS wants to see a client's diagnosis on the bill, checking this box will actually cause an error, so you can't forget, okay? This is all helping so that nobody forgets to enter information that has to be there if you have to bill. If you don't need this stuff, you can leave it blank. This is just creating those additional like validation security steps to make sure you don't make a mistake, okay? Modifiers, some services have modifiers that have to be sent out. Maybe you get more money if you with translation or something. This is where you would enter a modifier code. I don't think this claim type is really relevant for you guys at all. Those are the basics. All right. I promise we're almost done. Like we had to set up a service rate, we have to set up a reimbursement rate. All right. So if we decided our one service we talked about before, we got $100, but someone is not going to give us any, or they're going to give us 60, we set up that corresponding reimbursement rate, okay, because we're tracking both pieces in the system. They could be the same, so you could set them both at 100. If you're not getting money, set it at 0, okay? So you have to have one. It doesn't have to have a value, okay? And again, we're picking a staff type. So if you only have one staff type, you know, set one up for one staff type, put $0 in, all right? everything will go through okay. Effective from and to, again, we're doing that date range in the system. We have duration. So here it's saying for one 15-minute service, we $10. Okay. Units, they're almost always set up as one. So think of it as one, how long equals this much. Okay. Rounding rules, you're able to tell the system if, so the 15-minute service, if we provided 12 minutes of it, round up to the nearest 5, down to 5. Some payers have these requirements, and you're able to define those in the system, okay? Again, these are not required fields, so just leave those blank, all right? And then you're able to attach if there's modifiers, again, different HIPAA modifiers, like with translation, I forget what all of them are, but you would attach them here if that was something you did. Diagnosis for reimbursement. This is not a commonly used feature, but if I'm trying to come up with a relevant example. This isn't going to be, but for HCBS, they said you are only allowed to send us a bill for this person if they are schizophrenic. You can set that requirement here. There's a limit. This is saying only if they have this diagnosis is this acceptable. Leave this blank, any diagnosis is acceptable. So this is like a limiting field, okay? Credentialed clinicians, this says only this staff person is allowed to perform this service. Leave it blank if that's not the case, but if you have a service where only one staff person or only 2 people are actually allowed to perform that service, you could set it up here, and the system double checks in the system. So if you set this up and you only have 2 staff people that are allowed to perform that therapy session, and someone else says they performed it, it'll create an error, okay? So it's doing the double checks, like, hey, that person shouldn't be doing it.
Can you go back?
Yeah.
As part of the security settings and change it?
Yeah.
Okay.
Yep, you can always update. Any of this can be updated as you go, okay? So you try to set as much up in the front end as possible. It's like front end loading your work so that when you're doing all the other stuff, the system's automatically calculating and tracking and stuff. But yeah, anything as things change, you can add and active and all of that. Absolutely. And again, I know, in the future, maybe we're getting more billable services and stuff. So that's why I'm making sure to go through all of this. So you do know what it does, but this stuff you don't have to worry about if that's not relevant to you at all. All right, finally, like how on services, there was this additional field. There was an additional field here on reimbursements for like errors mapping, okay? There's a lookup, and then some of these are gonna populate, all right? So we'll look at the utility, but there's a way Donald's preloaded information, and there's a way so that it can preload some information. So based on what you select, it'll actually populate the fields for you. Go ahead, thank you.
Yeah, just what we did, what Core and I do how it worked out, and the AIDS Institute, is that you're going to upload your planning file into Core. And then when you set up services that are supposed to be exported to AIRS, that's what that's doing. That super, super long string of zeros, that's actually the record number from the planning file of what you want to export that services as. So you don't have to enter all the codes that go with AIRS. For a particular service, you pick them from the planning. Just like when you update AIRS, when you get a new planning file, you will update Core when you get that new planning file. And then, you're only going to do this once or twice a year. You create the services, you do all that stuff. That's why this reimbursement section and all of this is so important, because it is used for your AIRS exports. When we get to HCBS, it'll look different. I don't even know how to talk about it. But this is how you're going to get services that are supposed to go into AIRS filled out. AIRS is going to accept them right here because you uploaded the planning file and then pointed the service to it.
This is a really good example. We've been saying data consolidation, right? Like that's something that's been the magical word of the last 6 months talking about this. This is key features of data.
So this is it, this is done. We have exported, a test file from Core, which is compatible with AIR's standard. Now, the reality is AIR's is still not on there and it built something to import that, but we met all their specifications. Core also, Core and IDoHunt together.
How will that change with the continual errors updates? Will Core have to do updates in unison?
Not the same issue. I mean, God forbid, AIRS is going to change its structure enough that we would have to rewrite the structure in Core, and we don't anticipate that.
If it happens, we will figure it out. Yes. But no, yes, I mean, Donald and everyone did a lot of work. So to get all of this and try to make it easy for you. So again, instead of having to hand enter all of this, you do have the ability to pull it into that upload and everything. How do you feel about this? There's a lot of information. We got through that basic structure, okay? Does it make sense? Ish? Okay. I know, it's going to take looking at it and getting familiar with it, so I don't expect 100%, oh my gosh, yes, but if we're at ish, I'm okay with that. All right. All right. Talking a lot about, users and security in the system, okay? There's this piece here, configure security. This is where you're going to enter new users. So the system will be deployed. Your users are not going to be pre-populated in there because we're creating a master database, all right? So if we put everyone in there and then we copied it out to everyone, everybody would have access to everybody's system, which kind of defeats the purpose. So when your database is deployed, you'll go in and set up your staff, everyone who logs in, okay? Everyone's going to have their own login because you're going to want to be able to track where they are in the system. If people are sharing logins, you obviously can't tell who did what, so it's kind of getting rid of that. As you set people up, you create new user profiles, and this is where we're going to enter some basic information, okay? Now here in user profile, this is not where you actually enter a new user, okay? Stumps everybody. This is just showing you the user profiles that are already there. To enter a new user, you actually come to manage users, okay? Manage user, create new user. What users did you do all the way through?
We did New York test 1, 2, 3, 4, 5.
Okay, so account name. This is the user name. When we logged in, where I was saying it's an email address. All right, everyone's username is an email. So it's either work email, et cetera. It has to be email format. All right, I'm going to walk through. Yeah.
I was going to say really, really quick, do you remember how a lot of you guys filled out a template for me that had the list of all of the users and the emails and everything like that? The idea is that we were hoping that we could upload all that information and get that all set up before the training phase, but there were a couple of delays. And what happens right now is we're looking at the IDoHunt master system. We'll need to tweak some things and then copy it over to all the different providers. And then at that point, everybody in this room will be going back to that template. The good news is you already did all the work and submitted it to me, right? I'll send you back that template and you'll just go through this step. So I wanted to just highlight you have all of this information already for your agency and pay extra special attention to this piece.
Yeah. We did. We wanted to make sure it was complete before we copied it, so that's why we didn't go ahead and just do it. So we're just verifying all the information because we want it to be as accurate as possible when you get it, and then you're able to do your own stuff. All right, so because everyone here is going to be new users, we're actually going to set up a user, okay? It's a fairly easy process, but I want to walk through it with you so that you see all of the steps. Account name. So again, we are setting it up as an email address. All right, and this is what they will log in with. Password, you set up a temporary password you give everybody. It will yell at you if it is not meeting, you know, basic password requirements, 8 characters, 1 number, 1 symbol. All right. So it will tell you if you're not doing that. And then again, email, just put the same email. It's looking for both. Your username could technically not be a valid email address, but the email.
Is it gonna not allow you to set up a username if by any chance you have somebody with the same email at the agency, like Jessica Torres and Jose Torres? So they will both be J Torres.
Yeah.
So, you're gonna have to like how do you treat somebody's email?
So it won't let you have that because it would be the same name. It doesn't actually have to be their email address. So you could say Jessica Torres, Jose Torres. Okay, so you could spell it out. So even if the real email is J Torres, you could spell it out. So it's a secured system. You're not emailing in or out of the system. Okay, so it doesn't really have to be the email address. The system's not going to like send them a check because it is a locked like EHR. So you can just spell out their names in that scenario or come up with something else. Okay, so we set up the basics here, all right? That didn't take us long. We set up a name. We obviously haven't like said who their name is yet or any of that basic information. It'll take you here to the Manage Users screen, okay? From here, there are 2 things you should do. It defaults them to an unassigned role, all right? We're going to talk about roles in more detail, but as you're setting up users, assign them to a role. All right, it's going to make it easier if they like lose their password, forget something. If they're not in a role or you don't do the next step, it's harder for you as administrators to go in and like passwords and find them, okay? So if they don't do what you tell them to and go like actually log in and set up their profile, there's some basics to make your lives easier. So this is just kind of like advice. So I would go ahead and assign them to a role, all right? And then you're going to want to go to user profile and fill out the basic information for them, all right? So name, last name, again, this is gonna make it easier for you to search and find. If you don't have a name and last name in here, when you try to reset a password, they won't show up, okay? So you gotta put in their name, last name, and I recommend doing it because if they don't go log in and then they forget the password, it's just harder, okay? And again, when they log in, prompt them to enter all this information. So you don't have to fill out their address if you don't know it, all of that. So they go in, verify that this is correct. So there is that another step too. What is their address, zip code, basic kind of stuff. If you don't know their address, you can just update with fill in. So when they log in, they can fill it in. All right. So you just got to get the basic mandatory stuff in here. These fields are not mandatory. If they're needed for billing or tracking, you're able to record their social security number. Again, if we're like billing out services and that's needed by the payer, it's not always needed. Sometimes it's needed. Their NPI number, again, if we're billing and their NPI goes out on that bill, this is where you enter it and it pulls from. Billing staff type, okay? This is where we were talking about with those service and reimbursement rates. This is what it's going to check. So if you have one billing staff, everyone could just be, you know, boom, staff could be the billing staff type, all right? Or you could break it out if you really do need to be tracking, you know, based on the actual people's roles, and it does call into like reimbursements and, you know, how much you're tracking and paying. So you do have to have the billing staff type. AIRS user ID, all right? So this is where their AIRS user ID is going to be entered. In this, there's electronic signing of documents. Okay. Logged in users sign documents using PIN. So instead of mouse signing, like on the screen, which is never works out very messy, you actually set up your own ePIN. Think of it like ATM. It's a 4 to 6 digit code that only you know. You can go in and update it at any time. And that's how staff, anybody would electronically sign files. When you set up that ePIN, go in to sign a form. If I were to go in, enter my ePIN, click save, it would say document electronically signed by Jessica Warrens on November 17th at 4 p.m. or something, okay? So it will electronically sign for you. Users will see this screen when they log in for the first time, so they go in, set up their ePIN, they go in, and then they can set up like a security question too, you know, for retrieving passwords and stuff. You are also able to enter credentials or job titles for people. So if when they sign documents, you want to be like signed by Dr. Bob, you know, you can have all of that there, and all of their credentials can show up as well. That's what we're doing here. You don't have to put it on there, but it will show signature. Okay, so really information. If we were setting up a new user, we would just go in, put their first name, last name, fill in their address, or put something in to prompt them to go and update it, and click save. So now this user is in the system. They will have to go log in, all right? Log in with the test password that you set up, create their own password, and kind of go through the registration process, all right? The basics, that's what you have to do. Create the user, assign a role, go update the basics on the user profile, all right? And this way, if they forget their password, because everybody forgets their password, you know, you can find them, you can easily reset the password for them without having to go through the process again.
Each time an admin does a password reset, they'll need to then enter a new password.
Yeah, so I could go right now. Let's go reset my password for that guy. All right, so I sent him his information. I'm like, go log into the system. They forgot. 2 months later, they try to log in. Oops, can't remember the password. All right, so let's go reset for them. You come here to reset password, search for username. So this is why you have to fill out that user profile, because it's looking for the username. Didn't fill out the profile, there's no username. I forget what I named my person, which is not helpful. All right. So go in, select the name, select the reason. Again, you're creating a history here, right? So you're tracking every time that password is reset. Hopefully your staff aren't going in and just, you know, playing jokes on people and randomly resetting passwords. But if they were, they would be recording a history, so you could tell them to stop. All right. So you go in, why is it reset? Date authorized, enter a new password for them. And if they've tried a couple times, they've probably locked out their account. As good practice, just click unlock account in case they did that. All right, and then send it to them. Then you would tell them a new password, and they would now be able to log in, and then they would have to enter their own password. Okay, so again, every time you set a password for them when they log in, they will have to redo their password, so you're not going to know their password, okay? So it is keeping that system secure.
And they'll have to use a new one. They even if they accidentally remember their old one and put that in, it's not going to let them use the old one.
Yeah, so there's some basic security things. I think you can't use the same last 5 passwords. It can't be the same password within a year. You know, kind of basic. Sometimes gets annoying because you have to remember your new passwords, kind of stuff. The system will make users re-enter passwords. I think it's every 6 months just to come up with it. Because again, you know, this is a secured system. You can track, you know, data in here, so it is just keeping those basic security functions.
How many failed attempts before a person gets locked out?
I think it's 3. Yeah. 3 or 5. Okay. That's the basics of setting up users, all right? Name them, fill out their profile, get them to log in. When they forget their password, reset it for them, then hopefully they eventually get in. Now I want to talk about user roles, okay? Everything in the system down to the form level can be turned on or off from a security setting. Every form we've looked at, every place, every tab, every one of those like little blue things in configuration that we could click on, we can grant people rights to it or take it away. All right, so we can control the system so people only see the things, clients, locations that they need to. All right, that's done through two different pieces on this configuration: manage users and manage roles. I think Tycho has been working on building out some basic kind of roles. They can obviously be tweaked for your organization, and you can also create your own roles. What are roles? If you have staff that you can group to perform basically the same function. So system admins, right? People who are going to be maybe in this room setting things up, need access to all places in the system. You would have like a system admin role. You'd have rights to everything. You could see everything. You could do everything. That's a role. Maybe you have people who perform like counseling or therapy, group sessions. That would be a role. They could have slightly different jobs, but if their basic role is the same, all right, so front desk, maybe you have 12 people that you consider front desk, administrative, whatever. Essentially, they need the same things. You can set up as a role to help save time. Roles are meant to save time. If you can group staff together, you can set up securities and permissions for a group and then go adjust for that individual, okay? So maybe we have 4 staff people that directly interact with, your clients in the clinic, all right? 2 of them do this one function. This other person sometimes does this other thing that's slightly different. We can assign one role, and then I can go into that one person does something that's slightly different and give them additional securities. But I don't have to go in and do it all. I can copy that role's securities and do it for that person. Why does this matter? To look at what actually can be done with a role, all right? Both when you're setting up roles and individuals, you're going to have the same options, all right? This first box, kind of as you're navigating it, there's this drop-down called Feature Group. Feature Group corresponds essentially with the tabs in the chart, okay? So clients would be my client chart, configuration, that kind of stuff. Advanced rights are overarching rights in the system. You know how I've been talking about you could limit your staff so they only see clients in the same program as them or location? That's where you're setting it up right here. Administer all clients. This says it doesn't matter what program I'm in, what location, me as the staff person I'm assigned to, I can see all clients, any client chart, any data in the system, okay? Administer all clients, it doesn't matter. Your administrative, maybe your supervisors, anyone who needs access to all client charts, you would give them administer all clients. I'm going to skip emergency access for a second. Restrict clients by programs and locations. So maybe you do have those billable clients, the ones that you need to make their charts more secure, maybe for HCBS, you're collecting that HIPAA kind of data, and you need to be able to lock down those staff types. I could go ahead and select this for my staff, and that would say they can only see clients in the system that are enrolled in the same program and assigned to the same location as the staff member, okay? So if you had one location, but you had 2 programs, you had STEP and you CBS, if you had staff that was only assigned to STEP, they wouldn't be able to see any clients that were assigned to HCBS. Okay, so you're protecting those client charts. That's what you're doing here by program and location. Getting even more granular, you could say staff are only allowed to see client information for clients where you have said that client is assigned to that staff member. Okay, so again, maybe for like those billable kind of HCBS clients, you want to restrict it even more. So you can get really tight on securities, basically. If you just don't check these boxes and give administer all clients, everyone will be able to see everybody's client chart. So again, how relevant is this for you? Do you need to drill down that security or not? The ability to, okay. Emergency access. So let's say, you know, I am restricted to only see clients in my program and location, and same with Sarah, and she's in a different program. Sarah wins the lottery and goes to Europe for a month. I can be granted emergency access to her clients, which basically copies all of her securities, clients, et cetera, to me so I can see her stuff. Okay, so if someone goes on vacation and someone else is taking care of their clients, go in and like update that person's settings so they can see it. You can just give them access to Sarah's stuff, okay? Her clients, her charts and stuff. All right. For billable services, after a service is billed, it can't be deleted because you billed it, so you couldn't delete it in the system. You do have the ability to void that claim. This is just saying that the person is not allowed to void claims. Okay, it's only really relevant to billable services, but you can say who is allowed to, who is not allowed to go in and void a billed claim. All right. Client chart talks about the header, and you're really not changing what people are seeing on that header. Clients is what talks about the client chart. Now our grid got a little bigger, all right? This is where roles really are helpful as opposed to for every individual person. What is happening here is every one of these lines is a form in your client charts. When we were in that chart and there were the accordions and there was all the stuff in there, these are all of the forms available. You have the ability to say whether Sarah can see the form, if she could add a new form, so fill one out, if she could delete a form that's been saved, if she can edit a form. So maybe I want her to be able to fill out new forms, but I don't want her to be able to go back in later and change it. I can say she's not allowed to edit, okay? I can also say if she's allowed to print it or not, right? So this is our medical record. You don't necessarily want people being able to just print stuff, all right? So you're able to restrict on the form level all of those actions for everybody, okay? This can take a little while, you know, setting it up the first time, which is why you have the role to help time. So if, you know, all of your administrative people basically need the same thing, you set it up, and then you can go in for each person and uncheck boxes or check additional boxes. But it's kind of like copy and paste security rights is what you're doing with roles, okay? Does this make sense? All right, I know it's a lot. Okay. So again, you have the same ability to restrict in configuration. You don't want all of your in configuration because you saw we can add programs, we can delete, we can rename stuff. You know, you don't want to give everybody access to that because it's real time, right? It's actually going to be updating your system. So you have the ability to kind of do that same granular security with configuration, okay? Finance, again, finance. We'll look at face sheet view when we get into the client chart, but what this print is, a way in the client chart where you, through face sheet view, can actually print the entire client chart. That's like printing the medical record, and that's what this is. So giving someone access to print in face sheet is saying they can print that entire medical record, okay? So that's what, you know, if like someone's leaving and wants to take their record with them, that kind of thing. Menu, this controls the tab. Can they see the tab or not, is what this is, all right? So if they need configuration, uncheck it, and you don't have to go through and do all of that other stuff. So if they don't have access to the tab, it doesn't matter if you turn on a form in that tab, they can't see it. So again, you know, you don't have to go in and mess with things people just uncheck the tab and they can't get there, right? And that way they're also not going to be seeing things up here and wondering what's in there, even though they can't do anything. So what's in reports? I want to play in reports. You know, you can restrict that. And again, as you go through, it's the same kind of thing. Turn things on, turn them off, make decisions. And this is a lot of data entry up front. Again, that's why I suggest figuring out roles and being able to group. And then you can get granular for individual people if you really need to. Kind of my advice, most important thing to be cognizant of is this advanced rights. 9 times out of 10, when your people are in the system and like they're like, I can't see it, why can't I see this client? You know, there's a problem, I don't understand. It probably is this advanced rights, okay? So you checked program and location and the staff isn't assigned to the program or something like that. It comes back to this a lot. So I'm just kind of, you know, kind of check this first. So with the role, when you not manage roles, and you then come into an individual person here in Manage Users, if you select that role, it will copy all of those permissions, all right? You can kind of lay roles over each other. So you could have staff as a role and supervisor as a role. You could then overlay things, so you could give someone both rights, all right? So you can kind of do a lot with all of that. Once those rights are copied, you can then go in and adjust for that individual person, okay? So maybe you have clinic staff, but again, that one person does something slightly different. No one else needs to see those forms, but that one person needs to see those forms. You can go for that individual. The next piece of this, and this is where, you know, when I was talking about programs and locations, why you probably got really sick of me talking about how you assign people to them. This is part of it. So for every staff person, you assign them to programs and locations. If you have one program, that's really easy. You go assign your staff to that one program. They can then do work for that program. This dictates what shows up in drop-downs. Okay, so when your staff is in the system and they're trying to say enroll a client and there's a pick list for program, it's only going to populate with the program you have said that staff can administer. Okay, 5 programs. I have 5 programs. I only say Sarah can work in one program. Whenever she sees a program list, she's only going to see the one program I said. Okay, and this is why you want to kind of find that sweet spot between being able to break it as much as you need to. But if I created 50 programs, that would kind of be a nightmare. I would have to go in and assign all staff to all 50 programs. If you have to do it that way, great, you can do it that way. But don't just do it that way to do it that way, because you're kind of creating more work for yourself also. Right, does that make sense? Same with locations. Staff get assigned to locations. Service locations, billing locations don't matter that much. All right, maybe you have 3 separate places you've decided are your service locations. You can assign staff to all 3 of them. You could assign staff to just one, maybe on the 1st floor, so-and-so sees people, but he doesn't see people on the 2nd or 3rd floor or something, okay? So the same kind of thing. And then this is what's talking to this restrict by program and location. How do we feel about that? Does that make sense? I mean, this part is a lot of just like upfront work. And that's why I think, you know, we're trying to build out those roles that'll be pre-copied into the system for you. So hopefully you're not having to do that much with it. You know, when we deploy the copies of this database, some will be in there, okay? But down the road, you know, I want you guys to know how it all works so that down the road if you need to change something or add something, you know what you're doing and you have that knowledge, okay? So we're trying to make it as easy as possible for you so you're not having to go in and duplicate, all right, effort. All right, I'm going to go over some other pieces here. Do we have any questions so far? This was the really big stuff, okay? So this was like the backbone system setup and set up users. So this was what I would say is like 80% of this configuration stuff, the most important pieces so far. We've talked a bit about being able to build forms and reports, okay? There are 3 different designer tools in the system. One is mail merge. Think about like a consent form, okay? So you want the person's name maybe, the date it was signed. There's a whole bunch of text they read, maybe like a checkbox, like a yes, no, or an initial, and then they sign it. You can set those up as mail merges. Mail merge, think of it like it's a Word document where information will pre-populate. So if we set up a mail merge, we could say pull in the client's name, pull in the last name, etc., so that you know, it's saving some data entry, and then they can electronically sign it. That's done in mail merge. Fields in these mail merge documents are not reportable the same way forms are. Okay, so this isn't meant to be data collection forms. This isn't where you're doing assessments or anything like this. This would be a form like consent or an authorization. Look at it, read it, sign, you're maybe capturing their name and the date or something, okay? So this isn't fill out 20 questions that you want to report on later. All right, so that's kind of the basic difference between mail merge and a form. All right. It's very similar to Word. It's not as fancy as Word. It's not actually Word. Same kind of thing. All right. So you type some text. You can mess around with font. You know, really format it so that it's going to look the way you want. There's a couple basic, what we call templates, but, you know, basic design. So you can go pick it. It'll help give you some headers, columns, just to save a little bit of time. You can insert tables in here. If you're, you know HTML, you're good at HTML, you can actually go in and type in the HTML and get a little fancier in your formatting. You don't have to do that, but for anyone who finds that fun, it's here. All right, but otherwise, really basic stuff. One of the nice things about mail merge are what we call mail tags, okay? This little guy over here, to me he looks like a mouse. I think he's supposed to be like a gift tag. This is where you find mail merge tags. A tag is saying what default information to populate in. Think about you're in mail merge in a client chart. So I'm with John Doe, and I need John Doe to sign a consent. I already know his name's John Doe, so I don't want to have to retype that. We already established it's John Doe. I know what day I'm doing it. I'm doing it. I don't want to have to like type the date because it's today. All right. And I already know John Doe's address. All right. So I don't want to have to retype any of that. I can actually identify tags and set those up to pull in for me. Let's imagine this was my consent. And John Doe, give consent. All right, so here I'm setting up a template. And when I open this in John Doe's chart, it will pull in with his name. Okay, so you're setting up this template here that will then populate with this information when you're in an individual client. Okay, so again, saving some time, making things easier. Some other standard tags are like company, so you don't have to keep, you know, retyping your company name because that obviously hasn't changed, you know, some stuff like that, okay? The other important mail merge tags are signatures, all right? So our consent form, right, the purpose of this is somebody has to sign it. In the system, there are two ways this can be electronically signed. Clients, anyone who's not a logged in user, okay? So you all have logins, you will sign with ePIN. Anyone who is not a logged in user, a witness, a client, a guardian, they all sign with a mouse sign, okay? So, because they're not logged in, they can't have an ePIN, so they sign. Those are set up with tags, all right? So, there are, I think, 5 standard tags. Client signature is one. All right. And then I also want to record the date it was signed. Every signature has a corresponding signature date. So if you have 4 signatures in this document, staff, client, guardian, maybe they're all signed on different days. You actually want to have the real date it was signed. Capture that when you click save, and it'll pull that date in to that signature date that corresponds with the signature, okay? We're going to go look at what this actually looks like in the chart because I know it's hard to kind of visualize, but you do set the templates up, and then we're going to go and see how it works. Yeah?
Is it possible to upload like a written form?
No, so, because I know everyone will try, you can copy and paste in here, but when you copy and paste from Word, it brings a lot of other stuff, okay, that you don't see, so it can kind of make the formatting go funky. If you're going to copy and paste, it's usually good to like copy and paste it in a notepad so it'll wipe out formatting. Okay, so like copy, paste in a notepad, copy and paste there and pull in here. If you copy and paste straight from Word, there's like a lot of that background stuff that'll make your formatting funky. All right. But copy and paste in a notepad if you're going to do it, and then copy and paste into here. All right. You can try copying and pasting from Word. Sometimes it works out. Sometimes it goes haywire. Just because, you know, Word has its own like code in the back end, and it just can get a little screwy. Okay. I know everyone will try it, so that's my advice. And I mean, if your document doesn't have a lot of funky formatting already in it, then it might work out great. All right. All right, so I'm just going to go ahead and put this ePIN in so we can all see what it looks like. And then we'll actually go look at this in the client chart so you can see why we're doing all this weird stuff. All right, so I'm just going to go with staff signature. Staff signature date. Okay, so I built the world's ugliest mail merge, but that's okay. Let's go take a look at what it's going to look like for us. All right, so we'll just kind of use this client for now. And this actually populates, I don't have it turned on. So this is great troubleshooting. Okay, so I'm looking for a form. Why isn't my form there? This will happen all the time, especially as you're getting your system. Remember when we were in securities, how I said you can turn on to view? My box isn't checked, okay? So I always try to talk about those securities a lot because when you're getting used to the system, a lot of your headaches are just going to be you didn't give them access or your rights were, you know, too restrictive or something. So as you're getting used to it and getting your staff set up, you're going to have to really play with that and make sure that stuff is showing up for the people you need it to. All right, this is great. Let's go trouble. So I'm going to go turn it on. I'm going to come find me, go into my user profile. Oops, not my user profile. Manage users. Clients is the client chart. They're in alphabetical order. I'm going to go look for mail merge. Mail merge letters. Yep, I didn't have access, so it's not showing up. I'm going to turn it on. One thing to note when updating these securities. So first of all, there's no save. All right. I just turned it on. All right. You don't have another step for save. When you check it, it gives access. When you take it away, it gives access. Depending on how complicated what you just did, it could take up to 20 minutes in the system to update. Usually with forms, that's not the case. It would be like if you're assigning roles and stuff, because the system has to like think about it, right, and figure out what that actually means. So it may take 20 minutes. I usually only find that to be true for roles, or if you're turning on like a really big form or something. But just to note that if it doesn't show up right away, it may take a couple minutes to update. Now if we go back to my client chart, the system will remember the last chart you had open, right? So how I keep clicking back and it's still there, it's not going to make me research for my client. It remembers who I'm in, okay? So just to keep it simpler, I could then go up here and search for a new person, but it will remember who I was working with. All right, so let's go see if it updated. There we go. So now it turned on. All right, so it is controlling what you see. To fill out a new form, et cetera, in the system, click the checkbox. If you just want to view what's already there, you click the magnifier. Select template. It's now populating with the template that we just built. Okay, so I'm going to pick my template. And now it is populating my beautiful letter into here. All right, great. I did a good job. Letter date. All right, so this is today's date. That one's mandatory. So in mail merge, the only reportable fields are these up here. Okay, so if you need to be tracking and reporting on signature date, you want to know how many times was the document signed or when was it last signed and run a report, you need to train your staff to enter the signature date up here. Okay, it's not going to be able to report on the signature date in this document. Mail merges are not ones we're going to report on. It's just a lot of text, maybe a signature. Okay. So here we go. What do I have? I had put company name up here, so it pulled that in for me with my tag. My guy's name was Test Client A, QA Client. I didn't put a space in, so it put it all together. So again, formatting, right? You know, you're going to come, look, make sure it's looking the way you want it to. Give consent. I can, from here, expand if this was a really long letter. All right, and you see there's a placeholder here for where my signature will be. I can also print preview, add mail data. So have added checkboxes to this form. We could have added checkboxes or radio boxes, text boxes where someone could type in. Maybe they needed to initial 4 things and sign at the bottom. We're able to enter some data in here, and we could have set that up in our template. And in here, in add mail data, I'm not able to delete, right? At the mail, I want people deleting my letter or anything in consent, all right, because they're signing what the piece of paper was. I could come in here and see this also in an easier to read format. All right, so let's say everything looks good. I read it. I do give. There's no way to sign it right now, okay? We click OK. We're saying we are OK with the content in this mail merge. Now my signatures appear. From here, you can sign, mouse sign, all right? Could clear it if that just really went terribly. Try again. Staff, click to sign. And now I enter my EPIN I set up in the profile. There we go. So it says here, electronically signed by user admin. Still hasn't populated my signatures yet, because remember, we could have deleted this. Approve. It now locks my mail merge. Can't edit it anymore. It's locked in. And my signatures now show up in the document, along with the date tags, because I put the date it was signed. Okay. And again, as you fill out these different letters for people, mail merges, it will keep a history for you. You can use this expiration, maybe consents are annual, all right, and you want to be able to track like who needs a new consent, who's coming up to need a new consent kind of thing. You can use that expiration date also for tracking. All right. How do we feel about mail merges? They're pretty simple. I mean, it's typing, getting it to look right, getting the tags you want in there. So that's pretty simple functionality there. All right. Form designer. Everything we've been in is technically a form. This contract was a form, and the client chart, those were all forms. You have the ability to build these on your own, okay? So it comes with all of these out-of-the-box pre-populated ones. Then there's the forms designer, where you can actually create your own forms. I know Brent and Donald and everyone have done a lot of work building forms. So as we go through the intake after lunch, there's a lot of IDUHA specific items in there, and they've done a lot of work building forms in the system. But when you're in the system and you're looking at it, you're something. So you have a particular intake item or questionnaire or assessment, and it's not in there, you have the ability to build it, okay? I'm not sure how much they will be building, you guys will be building your own forms, but it is there. So quickly, we'll go through this. Getting into it in too much depth is too much right now, but I want you to just see the basics of it, all right? So you can go in, build a new form. Form type, is it like a standalone form? Most of what you build is standalone form. It's all by itself. It's not associated with anything else, all right? You do have the ability to set up like a master detail form, like a parent-child relationship, so you have one entry and these others that are attached to it. All right, but most forms you build are standalone. You just fill out the one form and it's not linked to anything else per se. All right. Does this form go in the client chart? Does it go on the finance tab? Does it go on the utilities tab? Does it go in configuration? Mostly you're only going to be building clients and utilities. If you remember at the beginning, things in the client chart relate to one person, an assessment, where you're only filling it out for that individual. That goes in the client chart. A survey of a group, staff forms, ones that don't even involve clients that are identified, that kind of thing might be a utility, okay? More than one client. Dealing with people who don't have a chart, staff kinds of things, all of that would be a utility, okay? That's the difference. All right, name. Remember when we were in the client chart, those accordions? You can pick where it goes. If you want it to go in the clinical one, again, you can rename these accordions for your organization. So, but where do you want it to show up is basically what it is. All right. Dependency, what's required for someone to fill out this form? Client just means they have to have a client chart. And since we put this in the client chart, they will automatically have a client chart. So basically there's no dependency. You could say they have to have an open intake, they have to have a referral form complete, etc. So again, you're setting up like some validation. I promise we're not going to get too nitty gritty in this. I just want to show you the basics right now. Okay. So start to create your form. And we do have a recording or two we can also provide on more detail of this. So don't expect your this works. But basically, form fields are questions. Okay, so think about an assessment. What do you need to know on this assessment? You might need to know the date of the assessment, right? So someone has to pick a date. Date would be a field, all right? I find it easiest to think when you're on your piece of paper, field, question, okay? You can pick date, time. You can enter text boxes. You can have drop downs. Again, we're not going to spend time doing this right now, okay? But you do have the ability to kind of build all of these out. A mask is just saying the formats. So like, is it going to show up a certain way? There are masks for date, number, time, all right? So you know how dates show up with flashes, that kind of what we're doing with masking. I build fields, you can say, is it mandatory, is it not mandatory? You know, can they save without entering this information or not, okay? I'm going to build out 3 fields, and then we're going to look at my beautiful form, okay, and we're just going to see the basics, okay? So now I want to know who filled it out, okay? There's a couple ways I could do it. I could staff. So who was the staff? You could have them type it in, but you probably not necessarily want to do that in a text box because it's in the system, right? So the system already knows who staff members are. So we could set it up to do a lookup of staff members or a drop down, okay, of all the staff members in the system. Integers, drop downs, lookups, things you're picking stuff. String, text boxes. Again, I have recordings I can send you on all of this, but that's kind of the difference in this, all right? So I can set it up to say, hey, I want a drop down of users in the system. All right. And just have them show a drop-down list, okay? So. I can set up a text box. All right, I can also set up yes, no checkboxes, okay? Once you build your form, you go turn it on for yourself, okay? Because anything you enter in the system, this is now new data in the system. Nobody has been granted permissions to this data. The same is going to be true as you build your own reports, okay? So I just want to show you the workflow. I'm not sure how many forms you're going to be building. You may feel really comfortable and kind of go crazy. You may not need new forms. Maybe everything that's already been built for you is going to work, okay? But you do have the ability to do this yourself. And I'm just going to show you really quickly what it looks like. Again, I know we're going very quickly today. And I promise after lunch, you will get to play in the system. And hopefully I won't put you to sleep too much. So you go in and you can see your new form. Thanks. Here we go. So here is my form. So I'm become comfortable with it. Obviously, everything we did was pretty simple, but you can pretty quickly build out forms. And so, I mean, we just created this form. So you do have the ability to add things in here, data capture. You can get fancy with it. So you can make it so if someone answers yes to a question, additional questions appear. You know, so there is a lot of formatting that can be done. You can create scoring. So maybe you have questions and your answers are like a value of 1 to 5, and at the bottom you want to know what it totals to. So if they answer like very upset, it's a 5, not so upset, a 1, that kind of thing. You can create automatic scoring in the system and that kind of stuff, okay? So it really kind of depends on how comfortable you are with that kind of functionality. And like I said, Donald and Brent have already done a lot of it, but I just want you to know that you do have this tool in the system as well.
Just a tip, if you want to create a form, outline how you want it to look on paper first or in Word or something first. Know what order you want your items to appear in. before you start putting them in, because although the order can be changed later, it's more complicated.
Yep.
Right? So if you get to the end of your form and you go, "Ah, the first thing I wanted to ask for was the date, and I left out the date." You gotta do a lot of backtracking in order to change that order once it's in there. So try to enter them in the order you want them to appear, and then you don't have to do the extra work of moving things around.
Yeah, that's great advice. No, and that is good. It's usually good to know what you want, because like you said, you go in and reorder things, but it'll automatically default to the order you enter the questions, okay? And you can go in and move them, but then you would have to start numbering those fields and thinking about it. So right now it's automatically just saying like 1, 2, 3, 4, 5 for positions. It takes a lot of effort sometimes to go and move things around. So usually good to have a plan. All right, so how I've said, every field is reportable, all right? We pre-build some reports, all right? Basic stuff typically people need. Again, we didn't pre-build them for you, they're out of the box. We just kind of think it's what a lot of people need frequently. Might not be exactly what you need. You might need your own fields in there from your own forms. You might want it in a slightly different way. We do give you the ability to build your own forms, okay? Through what's called Report Designer. Report Designer is organized into categories because there's a lot of fields in the system, okay? So they're grouped by things that we thought grouped together. You can tell us to regroup them, to add different things, okay? So again, this is box, everybody's a little different. So we grouped them in ways we thought were logical. Everyone can request different fields, different categories, groupings, okay, etc. So just because something is there in a category and you think something shouldn't be there or you think that category is crazy, we can change it, okay? But they're basic by something. So clients 1 and clients 2 will contain like basic client demographic information, you know, when they were enrolled, that kind of stuff. Clinical might have your services, maybe diagnosis, that kind of stuff. Finance will obviously be more financial related information. Encounters. In the system, the form we use to say a service was performed is the encounter form. So you can think of encounters like services, okay? This would be some client information, some service information, etc. I'll just go into one really quick and show you. We won't process necessarily. But when you go into a category, it shows you all that are available in this category, okay? These are anything that you could pull into your report. So if you were trying to find a report of all male clients that were born after 1995, okay, you can designate those as the fields you want to pull into this report. You can relabel how it shows up. If I don't pick anything else, all right, my columns will show up like this: client name, birth date, gender. Maybe I don't want it to say client name, I just want it to say name. All right. Birth date, I can relabel to date of birth. If I don't put anything in, it'll default to this. All right. So you can just kind of build out and design your report. Alignment, your report is a grid, right? Like Excel. Where do you want the information to align within that column, basically? Think of it in those terms. So defaults to left, but you could center it or you can move it to right, kind of thing. Width, depending on your report. So if I built this report, I only have 3 fields. It's probably going to look a little funny because my screen's big. This is only 3 things. I could adjust those widths to make it look nicer. Okay, I don't have to. I can leave it like this. But if you're really, you know, getting into it, you can control like how it looks. And that's just for readability, you know, view kind of thing. Some fields in
That's based on character?
Yeah, character, thank you.
width?
Yeah, width in the system is usually characters. So like how many characters? Like would I want client name to always appear like 30 characters wide my column in Excel, okay? Some fields, like date of birth, there are different ways it could pull in, okay? It's a date field. It doesn't know date of birth, you don't care about the time. But maybe on signatures, you actually want to pull in the time. So date fields will give you options on how you want it to appear, okay? So for birth date, maybe you want, the 1/1/20, that one. Maybe you want to know what day of the week it was, okay? You can change how the information populates in the report, all right? If you're starting to get into, more complicated reports, you can come and you can group in order, all right? Maybe I want to group this by men and women. Maybe I wanted to group it by year. So I'm just having a report of everyone with birth date, but I want to see how many men are enrolled in, doesn't work as good with year. So how many men are enrolled in the STEP program? What are you grouping by? Do you want to see all the STEP program first? Do you want to break them out by programs? You're able to kind of manipulate how the data shows, okay? For financial ones, so if this was one dealing with money or time, duration, kind of number, you could sum them, you could average. You have the ability to kind of manipulate data in that way too, okay? So, you're obviously not going to be like summing or averaging client names because that doesn't make sense, but if you're dealing with like units, time, you can build out reports that'll do that. Count. So what did we want to know in our report? How many men do we have in the STEP program that were born after 1995? If I say count, I am telling it to tally, to total it for me. Because this report isn't any good to me if I then have to go 1, 2, 3, 4. So count. Count the number of men. Okay. Oh, sorry. Can grow. I set a width, 30. Maybe I have someone with a really, really long name. Can grow means that my fields can grow to accommodate it, okay? Otherwise, it might like cut it off or wrap it or something. But can grow means it can grow. All right, so you designed a width, but you say it can get bigger if it has to get bigger. All right, we picked our stuff. We go to next. We can change the order they report. So think of it like Excel. What do you want to be column A, B, C? Client name might make sense, but maybe because we care about gender in this one, we're going to put that first, okay? So we can kind of move them around, make it appear wherever we want to. In this report, I picked gender, all right? That could obviously be more than one thing, but I only want to know males. I can set criteria here that apply every single time. All right, so when you run a report in the Reports tab, you can enter criteria. This would say only show men. This is like criteria that applies to every single report. This is like default criteria. Okay, so this would be only show men or only show people born in 1995. Or you can set it up to birth date greater than or equals to, less than, is null, means nothing is in that field, okay? So you don't have to set this up. If I didn't set it up, I could run a report just based on those fields. But if I did want this to always be a report I only ran showing men, I could go ahead and do that and save me having to filter every time, okay? I'm not going to do that. Finish. So this shows me my report I just generated. All right, it shows it here because then I can go back if I don't like it. So I didn't really mess with my columns, right? So I have a little squished report. It's kind of funny looking. I might want to go back and set my width or something like that, okay? But if it looks, I can exit out. I would then need to go turn it on for myself. Again, through Manage Users, anytime you enter new forms or reports in the system, nobody can see it until you tell the system it can be seen, all right? The system just assumes it's going to default to no one can see it, all right? So come here to my Reports tab. Find my report, turn it on. And it then appears here in Client 1. Okay, so I mean, some of this takes some getting used to, getting comfortable with. Obviously, like I'm comfortable with, click through pretty fast. You can see it really isn't that difficult. You want to have a plan. You want to know what you want. but the time it takes to do this basic stuff is not that hard. Obviously, if you're getting fancy with your reports or your forms, you want those visibility options, you know, you want different requirements for when questions appear, not appear, that gets harder. And it takes a little more time and practice, but you are able to go in and kind of do all of this. I know that was really fast. Do you have any questions about this right now? Again, I know you're not going to remember this. This is a whole lot of information thrown at you at once. But again, I want you to get comfortable and familiar with what's available in the system, where everything is. You'll have to go in and look and practice. But I do want you to be aware of the functionality that's there. We do have, we have task guides and stuff. There's a whole lot of documentation too. And we're actually in the process of building out like a LMS system, like online courses. So I know there's 6 or 7 developed and they're churning some more out. So I'm not sure exactly when that's going to be available to everyone, but that is being worked on to help with all this, because it's so much. You're not going to remember this right now. So, you know, my goal at the end of the day is you to be familiar, able to navigate the system, aware of the stuff that's in there so that you're not scared and you can go log in and see. All right.
Jessica, are all the fields currently visible in the reports builder? Like, does everything automatically show up as an option to report on?
No, right now it does not. So this might be something that could be a good idea. We add them for you. So we could probably add all of like your custom intake forms you've done and get those added before we deploy this database. If you're set on that, could be something we do. But no, so right now, as you build fields, you'll just have to tell us and we'll add them. It's not automatically adding into there.
I didn't think I had seen any of those on there, and I wasn't sure if we could turn them on.
Yeah, no, that would actually, we can definitely do that before we copy, so that at least all of those do have specific forms that they've been working so hard will be in the system to be reported on. All right, a couple other things I want to touch on. User-defined options. You're going to do a lot with this. Every drop-down in the system, every checkbox, every yes, no, the options are pulling from yes, no, locate, all of that, they're user-defined options. You're saying what gets populated. Okay, so when we're here in this is just a good example because there's a lot. So here in the client profile, I have a drop-down for suffix. These are user-defined options. You can change these. You control everything in drop-downs, everything in these kind of checkbox lists, gender. Any of these are pulling from that user-defined options table. All right. I know, the IDoHA team has updating some of these, so they should be more relevant than just our out-of-the-box ones, okay? But again, if you're looking at this and you're saying, those aren't the options I need something else, you can control that, okay? You can make ones inactive. So let's say with ethnicity, if you're looking at it and you need a new ethnicity, so you need another option here because this isn't enough, you can add one. If you don't need an option, you can hide it, okay? Same with language. There's a whole bunch of languages in here. Maybe you only deal with 3 and you don't want to have to filter through this list or something, okay? You can make these inactive, okay? So all of this is in your control. Just because a list doesn't look like it doesn't mean you're stuck with it. You control that, okay?
So if you're changing something, will it keep what you had in it first?
Mm-hmm.
Okay.
Yeah, so it'll keep the record. If you've already saved, it's not going to go back and delete it. It would just be moving forward. So it's not going to mess up post-save data. That's a great question. But going forward, they would be the only things that populate in that list. Okay.
For all the specific forms that we've already generated user-defined fields for, it's better not to go in there and just start changing them, because then for data consolidation, we won't be able to have the same indicators for across agencies. So if something contractual appears that needs to be on there that's not currently on there, then we need to let the team know, and we can change it across the board rather than it just being one agency at a time.
Yeah. No, and that again, that's a really good point. So I mean, you guys are kind of unique in how you're structuring this, where you're doing this data consolidation. You know, you're going to have this master database and the ability to kind of do that overarching administrative stuff, to come up with internal processes, and whether it's every agency's updating their own stuff on their own forms, or whether, you know, you're requesting Brent Donald kind of thing, but just so you're aware of what it's doing and then what that user-defined options table is doing. Kind of, even if you're not updating items on client profile, as you build a form, so maybe your assessment, you need your own assessment in here. The ones that are in here aren't okay. And on that assessment, you're going to have lists of options, possibly, right? If you're not typing everything in, you will be building out those user-defined options tables. So if you have a checkbox list, like, how are you feeling today? Great, not so great, horrible, I don't know. Those 4 options are, so you will be building those out in the system, which is why I want to show you this, okay? So if you look here, there's a bunch of UDOs. There's 4,000. That's because this is every single drop-down box anywhere in the system is controlled by this table. Okay, so I could search for race, and here are the items that are populating in my race category. UDID, this is automatically assigned by the new records created. Okay, so you're not entering the UDID. It's like the system's identifying that and giving it its own number. You're not going to mess with that much, except for sometimes when you're building forms, like if you want only populate a certain question if they answered I don't know, you would need to know the UDID as a reference. Again, we have documentation on that. Code, so I'm not as sure with your ones you've built out, probably for errors, certain codes are built out. But this is like if this is selected and you have to report out on it and it has to send a certain code. So like place of service, where you were asking with billing. Place of service, office has a certain number associated with it. Client home has a certain number. Those are actually set up in UDOs, okay? So the code is where that 11 something, okay, for like how it gets reported. We don't delete in the system. All right, there's no option here to delete. If you don't want it to appear, you make it inactive. Okay, so again, we're not deleting stuff in the system. We're trying to keep a record, make it inactive. And because this UDO could be referenced on a form, if you delete it, that's going to cause all kinds of problems because it's saved somewhere else. So how can you delete something that was saved? You make it inactive so it can't be picked up. Okay. You can build out your own UDOs. You could add to a category. So if you guys talked to Brent and Donald and you needed a different race in there, there wasn't one you needed, they can add race, option to race, okay? As you're building your own forms, all right? So we have an assessment form and you need to know the how are you feeling question. You could build out a category for how are you feeling. And then within that, you UDOs for feeling great, feeling terrible, feeling fantastic, okay? So that's all done here. Category, if you pick select, these are the categories that are already there. So if I wanted to add to race, okay? If I'm building my own category, I click this little box over here. This is new, just this little guy. We're creating a new one for the how are you feeling category. All right, click OK. So keep it there. And then I come down here and this is where I type in what I am. I feel great, okay? This is what would appear in the pick list. The description is what are you picking? What are you clicking on? What's the option, okay? Code. For ones that had to be reported out for errors in eShare, they've entered codes. Code is a required field. If it's not being reported out, like it's your assessment, you can just put 1 in there or something, okay? They'll have to be unique, so you'll have to go like 1, 2, 3, 4, 5 as you do your answers. I'm not going to save this so I don't have this weird category in the system, but you would also come in this way, edit, and make inactive. So if this was no longer a relevant option, you would just make it inactive and it will no longer appear. Hopefully you guys aren't having to do too much with these UDOs. Again, because you will have access to this, and I don't want you like necessarily going in and messing up the errors stuff or not knowing what it is. That's what this table is. So it's controlling all of your lists in the system. We only have a couple minutes. Diagnosis codes. We've pre-populated a subset of diagnosis codes in here. There's something like 90,000 ICD-10 codes. We didn't put them all in because you don't necessarily need them. We can put them all in, or if there are ones that are missing that you need. So if you look at this and it's like those aren't the codes we need at all, we can put them in, okay? So you would just tell us and we can put them in. We don't do it off the bat because it's a lot of data. We don't want it to slow the system down. We can obviously speed it up if you need them all, but we just don't put it in there because a lot of our people don't need all of them. We put in a lot of like the alcohol and behavioral health ones, but if you do need those physical health codes, just let us know, okay? If you're looking at this and it's only missing like 1 or 2 diagnoses, you don't need all 90,000, but like 2 of the ones you use all the time aren't here. Actually manually come in and add a new diagnosis code. Okay, so it's not like all or nothing. If there's a group you need, tell us, we'll put it in. If you need to enter like 2 more, you can go in and you can just enter them here, okay? So you do control your diagnosis codes. You can also end date them so they don't show up if you need to, okay? So you can control, this again is controlling a list that people can pick from. So when someone is in information and attaching a diagnosis to them, this is what would populate, essentially. So, it's one of those I would review and thinking about what you need, if you need stuff, if there's additional ones you need, figure out is it like 2 additional, all of the health codes, that kind of thing, and we'll work out how to get them in there. The other one to touch on really quickly, and then I'll probably let you go maybe 10 minutes early because I have fried your brain, is there's an audit log in the system. This records everything people do in the system. It records every keystroke. It records if you look at something. If I go into a client chart and look at a form, it will say it in here. It will say what client I was in, what I did, what the original value was, if I entered a new value, who did it, so me, when it was done, the exact time it was done, and the action. So you can see here, it's recording that we viewed. Update, it'll record delete.
Does it also record login history, the system? Like, let's say you're supervising somebody and you want to say login.
Yeah, it will because it'll record. I don't know specifically if it says logged in, but indirectly it absolutely will because they'll see something, so it'll record that. Does that make sense?
Yeah.
But we'll find out. We'll get you an answer on that. That's a really good question, and you kind of stumped me. Yeah, we'll find out. Yeah, so this is tracking everything. And again, it is for that audit trail, HIPAA and stuff. People can't just go looking at people's charts if they have no reason to. If somebody changed something, if they deleted, you have the record here of everything that happened in the system. Okay. This file gets huge, as you can imagine. You can export it to Excel. A lot of filtering functionality here. There's advanced filtering and stuff like that. So it is massive to work with, when you're going through a lot of data, but it does capture that granular information on exactly what happened in your system.
So do we have an administrator that could log someone out in the event that they freeze?
Yeah, to like log them, yeah, so in manage users, you can actually, I'm not, if this is what you're talking about, but I can go in and I can lock somebody out. Okay, so if I don't,
Them out of the whole system.
oh, this won't, if that's what you're asking. It doesn't, no, you cannot necessarily do that. You can tell us and we can kick someone out.
So if
What do
But
you-
it's not like AIRS where you're gonna get, it's gonna freeze and the person's gonna remain logged in.
no, we hope not.
Well, it's not like
Oh, I
anything
see what you're
happens.
asking. Okay,
But, so all they have to do is close their browser, reopen their browser and log back in. It's not gonna keep you logged, that browser closed.
yeah, no, it won't keep you logged in. There's also a timer in the system. It'll automatically log you out after inactivity. You can set that timer to whatever you want. I think our default, I think for you, it might be set to 30 minutes of inactivity, but that can be completely changed. So, but yeah, there's an inactivity timer, so it'll automatically boot people after being inactive for 30 minutes.
So in our reporting, if we want to report by graphs, we'll be able to make graphs that program also.
No, this does not do graphs. You can download to an Excel, and then Excel does graphs. But no, there's no graphs in here right now like that. Okay, so any other questions just about like this basic, like running the back end of the system right now? We're gonna get into the client chart, which I know is what you care about, and like the errors and stuff too. But we did a lot, and you guys hung with me, so we can break and then come back at 2.